Well, good afternoon, and I hope everybody had a nice weekend, and to all the mothers across the Commonwealth, a belated Happy Mother's Day. Today I want to talk about Northern Virginia's regional pace to ease restrictions, Petersburg's water, the DMV, and our elections here in the Commonwealth. First, we reported doing 9,801 tests yesterday, which is a great step as we work to ramp up testing. That hasn't shown up on the VDH data website yet, but it will in the next day or two. Now I want to give Virginians an update on where we are with our data metrics. You saw these slides on Friday, and they are also available on the Virginia Department of Health website. This is our confirmed positive cases by the date they were reported to the Virginia Department of Health. The blue bar represents the number of cases, and the yellow line is the 7-day moving average. While we've seen a slight dip in the past few days, largely these numbers are going up, and that's what we expect to see. This graph shows us how many people are being tested each day in the blue bars. The yellow line represents a 7-day moving average of how many people we are testing. As you can see, both the number of tests and the average of tests performed have both largely been trending upward. There are some dips where we have tested fewer people on the day, but overall this shows that we are doing more testing. This slide shows us how many of those tests come back positive. The dark blue graph is the number of people tested. The light blue at the bottom is how many were positive. And the yellow line, again, shows the average. I have said I want a 14-day downward trend in the percent of positivity, and that is what we continue to see on this chart. This slide shows how many hospitals are reporting shortages of PPE. The blue bars are the number of hospitals, and the yellow line is the 7-day moving average. This is trending downward, which is good news. It has been several days since any hospitals reported shortages of PPE, and right now even the trend is at 0. Our adequate supply of PPE and swabs are two of the factors allowing us to test more. I might also mention that we have a warehouse here in Virginia of PPE, and our supply, our stock on hand is doing well and looking better every day. We're monitoring our hospital capacity to take patients. On this chart, the darkest blue at the bottom is how many COVID patients are in hospital beds. The medium blue is how many other patients are in beds, and the light blue is their staffed bed capacity. The yellow line, the dotted line at the top, represents surge capacity. As you can see, our hospitals are currently reporting that they have capacity, and we will watch that now that hospitals are doing more elective surgeries than in the past. This chart shows us how many people who have COVID are hospitalized. The total number is the dark blue bar, while the medium blue represents COVID patients in the ICU, and the light blue is COVID patients on ventilators. The yellow line is a 7-day average. Our ventilator capacity remains adequate at about 20%. As I've said, it's important that the Commonwealth as a whole can meet the metrics that we've laid out before moving into phase 1. But I also recognize that we live in a diverse Commonwealth and different regions face different challenges. That's why the phase 1 restrictions are a floor, but not a ceiling. While no region may move faster to ease restrictions, we're open to some regions moving more slowly. I have been speaking regularly with officials in Northern Virginia about this very issue. I asked them to send us a formal letter outlining that they are unified in requesting a delay. Uniformity across the region is critical to a successful strategy rather than having restrictions piecemeal across towns or counties. Northern Virginia localities sent me that letter over the weekend, and I appreciate the continued cooperation between our administration and these local governments. We all want a responsible, data-driven, health-focused approach. Northern Virginia health officials are using the same metrics that we're using for the state: percent positivity, hospitalizations, testing and tracing capacity, hospital beds, and PPE. So I'd like to walk you through the ways those metrics look a bit different in Northern Virginia than they do in the rest of our state. As we've said repeatedly, the number of cases alone doesn't give us an accurate picture of the disease, but we can make some comparisons across regions. And Northern Virginia consistently has a significant portion of our cases statewide. In the past 24 hours, for example, Northern Virginia reported more than 700 cases. The rest of Virginia reported fewer than 300. We see similar differences in percent positivity. Both Northern Virginia and the rest of the Commonwealth are seeing declines in the percent of tests that are positive, which is a good thing. But we see big differences in the percentages. On this slide, you'll see Northern Virginia has about a 25% positivity rate. And on this slide, you'll see the rest of the Commonwealth is closer to 10%. So again, while the trend of percent positives is coming down in both Northern Virginia and throughout the rest of the Commonwealth, the percent positives is much higher in Northern Virginia at 25% than it is at the rest of the Commonwealth at 10%. Again, the same can be said about hospitalizations. In Northern Virginia, COVID patients make up a significantly larger portion of the region's hospital bed capacity, as you'll see in this slide. COVID hospitalizations are the darkest blue area at the bottom. And this slide, of course, shows COVID hospitalizations in the rest of the state. Again, the dark blue area at the bottom. We will continue to work with those officials on a slower phase one, and we expect that some local officials will join us for this briefing on Wednesday to explain how this will work. The key to all of this is testing. This weekend, testing went on in a variety of localities, as you can see from the pictures in these slides. For example, there were drive-through testing sites in the New River Valley, as well as community testing on the Eastern Shore. And we are targeting testing at our at-risk neighborhoods. I'm going to ask Dr. Janice Underwood, our Chief Diversity Officer, to come up to speak about our efforts to increase testing and to provide masks, hand sanitizer, and information in underserved communities. Dr. Underwood, welcome.
Thank you, Governor. Hello, everyone. My name is Janice Underwood, and I am Governor Northam's Chief Diversity Officer. The Health Equity Task Force provides leadership to the Unified Command Health Equity Working Group, which was proactively established at the onset of Virginia's COVID-19 response on March 11th. The purpose of the task force and the working group is to serve as the Commonwealth's first ever coalition during an emergency response to unapologetically ensure a health equity lens is applied to all decision-making within Virginia's response. The task force meets twice every day, and the working group meets every Tuesday to review policies, provide real-time learning opportunities, review communication campaigns, and to ensure small, women, and minority businesses are leveraged in the response and recovery. I lead the Health Equity Leadership Task Force, and Sable K. Nelson, Acting Director of the Office of Health Equity at the Virginia Department of Health, serves as the chair of the Health Equity Working Group, which is a combination of several state agencies and private human service agencies, faith leaders, and community leaders. One of the priorities of the Equity Task Force is to collaborate with local governments to provide support to vulnerable communities, because we know that everyone does not enjoy the same privileges for social or physical distancing or receive information the same way. Therefore, the task force provides localities access to health equity training for all city employees and volunteers, personal protective equipment or PPE, culturally appropriate educational materials to support diverse communities, and those materials are in all languages identified as being needed, and support in identifying neighborhoods at elevated risk with mapping technology. The Health Equity Leadership Task Force is comprised of myself, Curtis Brown, and Dr. Lauren Powell of the Virginia Department of Emergency Management, Sable K. Nelson, as I mentioned, from the Virginia Department of Health, and Ms. Alacia Black-Hackett from my office. The Health Equity Working Group is a larger body, as I mentioned, comprised of all the community stakeholders, such as state agencies, private human service agencies, and faith leaders and community leaders. So what we know for sure is that local and national data indicate COVID-19 is exerting a disproportionate impact on communities of color and African American, Hispanic, Latino or Latinx, and indigenous communities in particular. So in order to mitigate the projected debilitating outcomes on the African American community and these other communities who are at elevated risk, we've made 20,000 masks, 20,000 bottles of hand sanitizer available to Richmond City for distribution to its most under-resourced communities. Social distancing doesn't mean forgetting our need for community engagement, community relationship, and community connection. So the Richmond pilot is only the first of many initiatives that the Equity Task Force aims to lead throughout the Commonwealth. We recognize the pilot will not address all the needs of the communities we've identified, but we are hopeful that this is a model to ensure other resources make it to their doorsteps as well. Thank you.
Dr. Underwood, and to the Health Equity Task Force, thanks for all of the great work that you all are doing. Really, on behalf of Virginia, really appreciate it. We continue to increase our testing capacity, as you are seeing, and I expect to have some announcements, some really exciting announcements about testing partnerships in the coming days, so stay tuned for that. And what we're going to talk about is our ability to work with some of the retail stores across Virginia to have a lot more community testing, not only in metropolitan areas, but really throughout Virginia and in all of our zip codes. So I think that's something that we'll really be able to look forward to. Last week, we talked about the fact that Petersburg has some residents whose water had been shut off. I said then that it is unacceptable to have residents without access to running water when protection against this virus relies heavily on the ability to wash hands and other services. So yesterday, Dr. Norm Oliver, our health commissioner, issued a public health certification that prevents the city of Petersburg from shutting off water service to any occupied dwelling and requires the city to restore service to 46 homes. Restoring water service will help protect those households as well as the community. Now moving to the Department of Motor Vehicles. We closed our public-facing DMV offices early in this pandemic. I am extending that closure for at least the next week. Online services remain open. And I would remind Virginians that this is a difficult time for our graduating seniors. They are not being able to enjoy a lot of the things that all of us have enjoyed. There are also some high school students who have met all the requirements to obtain their driver's license. And I remember how much I look forward to getting my driver's license when I was 16. So I would just ask all of you to be patient. We are working through this. We will get our DMVs up and running as soon as we can and be able to get your driver's license to you. So I appreciate your patience. And finally, more than 50 of our localities have local elections coming up on May the 19th. Tomorrow, May the 12th. Tomorrow, May the 12th, is the last day for voters to request an absentee ballot be mailed to you. I strongly encourage everyone to vote absentee by mail. You can mark reason 2A. Also, we'll have beside it, my disability or illness on the form. Voting by mail is secure and is the safest way to vote at this time. We will continue working to make sure our physical polling places and poll workers are as safe as possible for those who do go out to vote in person. Now we'll hear an update from Dr. Oliver, and then we'll be glad to take your questions. Dr. Oliver, thank you and welcome.
Thank you, Governor. Just a quick update on the numbers that appeared on the VDH website earlier today. We now stand at a total number of cases of 25,070 cases. That is 989 new cases in the last 24-hour reporting period. Deaths now stand at 850. That's an increase of 11. And we have total tests of 167,758 tests, and that represents, as the governor said, now 9,801 tests in the last reporting period. So that's a good thing that that's been increasing. The number of cases in the African American community continues to be disproportionately high at about 24% of the cases. We reported 4,119 cases in the last 24-hour period. And not in the last, that's the total now. And the total for the Latinx community stands at 6,894, which again, as I reported last week, is about 40% of the cases, and I believe that's because of the outbreaks that we've seen in a bunch of the poultry plants in the region. Those outbreaks have been trending down. The number of cases has been coming down as we've put a lot of attention into dealing with those, and we're also looking at the community spread in those areas with big tests in both the Harrisonburg area and on the Eastern Shore, where we've collected thousands of tests in the last couple of days. Thank you.